Hey guys, welcome back in my YouTube channel NCLEXrn Preparation. Previously you heard about this channel only the name of NCLEXrn Prep. So now I just make a little changes on it, even in my channel logo too. Previously it was look like this. From now onward you will hear about this channel by the name of me NCLEXrn Preparation with Pradeep Saini, like this. NCLEXrn Preparation with Pradeep Saini. It's going to be a NCLEXrn Preparation with Pradeep Saini, and I'm so excited to let you know this is going to be a brand soon. Simply you just need to write a NCLEXrn Preparation with Pradeep Saini in a YouTube search bar and you will see the plenty of video down here, and then you are good. Watch any video whichever you like. So now let's come to the point. In my last video I already talked to you about that I'm gonna make a new video on the different job and responsibility of RN, LPN, LVN and UAP, and in this video we are trying to understand how this topic is really hot and important for the NCLEX RN examination. And also you got a lot of question on delegation type topic in your final RN examination, and most of the students, 70% student, are stuck on that and they choose a wrong answer on that topic. So by the end of this important video lesson, I guaranteed you will choose 110% right answer after watching this complete video on delegation type question and answer, and you won't need to anymore practice on delegation type question. And this is gonna be a really super easy for you guys. I just make a small PPT on different job and responsibility of RN, LPN, LVN and the UAP, and understand that which person has what kind of job and responsibility here. Here in United States, Canada and Australia, every medical profession has a different job and responsibility. जब तक आपको इन चीजों का पता नहीं चलेगा, आप तब तक एग्जाम में क्वेश्चन गलत करते रहते हैं. So in this video lesson we are going to talk about on it, and also we will practice a 5 to 7 question on the same topic कि आगे से आप ऐसे वाले question गलत ना करें. आपके पास कोई excuse नहीं होएगा, कोई mind में confusion नहीं होएगी कि आप ऐसे वाले question को गलत करोगे. I guaranteed you again guys. And this video lesson is powered by Unacademy. Unacademy is India's largest educational online platform, and they are launching their program globally now. And it doesn't matter where you are from the world, you just need to see the NCLEX RN content on their website, and this is gonna be a free of cost for you guys. No credit card requirement, no subscription required, you are good. Currently they have 100+ question and 7 mock tests on their website for the related to NCLEX RN examination, and they are coming up with the more content. And they also have a free NCLEX RN examination classes, and they trained a student as like you for their NCLEX RN examination. They also have a live video lesson, practice test, quiz, NCLEX live special classes on every topic for their NCLEX RN examination, and many more. I will keep you updated on time to time about this website, what they are adding on it, what they are offering on it, what they are providing special plan for you guys, etc. I will keep you updated in my upcoming videos, and I'm going to put the website link in my description box. So what are you waiting for guys? Go ahead and click on the website link in the description box and explore the NCLEX RN content. So now let's come to the point guys. I made this slide for you guys, and this topic, prioritization and delegation and management of care for the NCLEX RN examination, is really important for you guys, because in the final RN examination you got a 2 to 3 question from this topic, and that's why this video is really important for you guys. And also in this video we will try to understand what is the job and responsibility of RN, and what is the job and responsibility of LPN, and what is the job and responsibility of UAP. And also we will try to understand some strategy from this topic, and also we are trying to understand how we can the right one answer from this topic. And thirdly we also discuss top most 5 important missed NCLEX RN question. So stay on this video until the end of this topic. So now let's start the topic. First of all we are going to discuss about the RN responsibility. RN responsibility any kind of initial assessment, teaching, admission assessment, discharge teaching assessment of unstable client, blood and blood product transfusion, and piggyback blood transfusion. These are the category that are the responsibility of the RN nurse. So any kind of initial assessment, teaching, discharge teaching assessment, admission assessment of the unstable client, any client that come under A, B, C. Airway, breathing and circulation is that come under in RN. Okay. So assessment of unstable client, blood and blood product that come under in the RN responsibility. And now we are going to move forward on LPN or LVN responsibility. Focus assessment. Focus assessment. What does it mean? Focus assessment. Any kind of secondary assessment. Any kind of secondary assessment that come under in LPN responsibility. Any kind of secondary assessment, not in initial assessment. Just we are talking about a secondary assessment. Focus assessment on stable client that look the different stable client that come under in LPN. And here is the unstable client right over here. Unstable client come under in RN condition, RN responsibility, and any client that are stable and secondary assessment that come under in LVN or LPN responsibility. Okay, so we are talking to move forward on medication type question. Per orally, any kind of per orally medication, subcutaneous medication, IV or IM medication administration that come under in L responsibility. Reinforcing education, any kind of education that RN give the patient, it's a responsibility of LPN and LVN that need to follow of RN education, which means reinforcing education. Monitoring for the patient of changes, any kind of lab changes, any kind of circulatory changes that also come under in LPN or LVN responsibility. Trial, dressing and changing procedure that also come under in LPN or LVN changes. Does not include in center line. So except this center line, other all kind of dressing changes or trial technique that come under in LPN or LVN responsibility. NG tube and IV therapy requiring special certification. I'm gonna give a quick example of this one in the next slide. So now we are moving forward on UAP responsibility. ADL. So what does it mean? ADL task, which means activity of daily living, has lot of stuff in this like a bathing, ambulating, oral care that come under in ADL, has a responsibility of UAP. Secondly, we are discuss about the documenting input and output may include color and consistency that also come under in UAP. And changes of position on stable client, low risk patient. Changes of patient, so that also come under in the UAP responsibility. Obtaining vital sign on stable client. So always keep in your mind stable client. Unstable client, never give a delegate to LPN or UAP. So this is the very important point that come under in RN responsibility. Okay, unstable client. So next one is CPR. These kind of UAP, CNA, RNA also they have a very trained in CPR. So this also has a responsibility of UAP. Finger stick glucose, trial specimen collection if external, point to be noted here. Okay, if external, will get just forget about it. So this is the responsibility of RN or LPN. Skin care of intact skin and obtaining equipment and supply, reinforcing nurse technique and perform oral care and suctioning. So this is the job and responsibility of RN, LPN and UAP. So now we are so now I'm gonna give you a quick example of RN job and responsibility here that you need to keep in your mind and you don't need to forget all these. So first of all, we are gonna talk about the UEAT. So remember these abbreviation U, which means U as an unstable client, E as an evaluation, and A as an assessment, T as in teaching. So this is the key point. RNs cannot delegate key point. RN never give a delegate delegate to this U8 to somebody else, like a LPN or LVN or UAP. So this is the responsibility of RN. So we're gonna discuss about one by one. New admission. Any patient that come in hospital with the new admission that come under in RN responsibility. Returning to the floor after procedure, any procedure like a CABG, cardiac cath, any kind of surgery, hip replacement, knee replacement, post-operative after surgery, unstable blood sugar, vital lab value, sudden changes in respiratory rate or neurological status. So this is the unstable client. So always keep in mind, unstable client is followed by the RN. Second one is evaluation trending, interpreting data, lab value, pain and vital sign, that also come under in RN. And a second one is assessment, initial. So here is a key point, initial. Always keep in mind initial and primary. These two words are very important. Initial first and the primary assessment and new admission and the post-operative, that also come under in RN. Teaching. Last one is teaching. Teaching, initial and primary education, that come under in RN. So no delegation. Always keep in mind, no delegation, RN only. These three lines are always, it's a universal rule of NCLEX. These three lines, IV piggyback vary state to state, blood transfusion and blood product, centerline drugs and chemo and TPN. These are the three key words that you always keep in your mind, that no delegation, only RN. Okay, now we are going to move forward on LPN, LVN and CNA and UAP job and responsibility. So you have always keep in your mind, LPN, LVN has a similar job and responsibility in NCLEX RN examination. So don't be confused here in between two person, LPN and LVN in the NCLEX RN examination. In the other hand, if we are going to talk about the CNA, UAP in the NCLEX, so these two person also has the same job and responsibility in NCLEX RN examination. So first we're going to talk about the LPN and LVN here. Every secondary things are followed by, it's a thumb rule of NCLEX RN examination. Every secondary things are followed by LPN and LVN, like a secondary assessment, not initial, it's a thumb rule here, not initial or primary assessment, just a secondary assessment, monitoring, follow up, everything is followed by the LPN and LVN. Also medication, no IV push. So LPN and LVN is not authorized to IV push medication. Yes, monitoring blood transfusion, they can also monitor the blood transfusion. Yes, next one is administered IV piggyback medication. They are not allowed to IV push medicine, but yes, they are also maintain and calculate the intravenous fluid. Yes, calculation and monitoring the intravenous flow rate. Yes, per orally medication and the subcutaneous medication and IM medication, they are the job and responsibility of LPN and LVN here. So yes, there are the two factors that the LPN and LVN can do or cannot do. So first one is long-term patient. Yes, she can was the long-term patient going to be discharged. Yes, if the person has to be discharged from the hospital, they can see such kind of patient by the LPN and LVN. So there is some key point or doesn't look by the LPN or LVN. So no newly admitted patient doesn't look by the LPN. No post-op patient doesn't work. No evaluation or lab vitals. No initial assessment, we already talked. Previous first teaching, no. So these are the responsibility of RN, right? So now we are going to move forward on. So here is the formula that you can remember this CNA and UAP job and responsibility by VAPER, VAPER, which means vitals, ambulation, positioning changes, bathing, eating, recording, intake and output, no teaching, no assessment, no medication. These are the responsibility of CNA and UAP. Now we will practice the top most 5 important question and answer usually that missed in NCLEX RN examination. Top most missed question. We will discuss these 5 question are really important and interesting for you guys, and the 98% doubt will be clear by the end of this slide if you practice and understand these top most 5 important question and answer. So let's start one by one. Question number 5. first. So question number first, which of the following should the registered nurse delegate to LP and LVN? This question is based on the SATA question. Option are here. Administering subcutaneous insulin, yes, she can do. Assessment of a client returning after emergency procedure, no, she cannot do assessment. She is only responsible for secondary assessment. Initiating a primary IV medication, yes, she can do, but she cannot do a IV bolus medication, but she can take initiating a primary IV medication. Reinforcing teaching a client for recovering from a surgery, yes, she can support the RN and she can support reinforcing teaching that already been given by the RN. And urinary catheterization, yes, she can do. And secondary assessment for the client for a chest pain, yes, she can do, and she is responsible for secondary assessment. Question number second. This question is based on negative strategy. A client newly admitted for a myocardial infarction. Appropriate activity to assign a UAP would include all of the following except. This question is based on a negative strategy. We need to find the inappropriate option for the UAP and just eliminate the right one option for a UAP. So first one is teaching about the food high in sodium. This one is inappropriate, so we need to pick this one answer. Recording input and output, so this is the responsibility of a UAP. Assisting the ambulation restroom, this one is also responsibility of UAP. Reporting to the nurse that the patient complain of chest pain, this also come under in UAP. So these are the three options that are responsible by UAP. So this question is basically based on a negative strategy, so we need to find out the wrong one option for such kind of question. And teaching about what food are high in sodium, teaching. So here is the key point. Teaching word is only related with the RN, so it's a responsibility of RN. Question number third. The nurse is administering a 1 unit of pectoral blood cell to a client. 15 minutes after initiation of blood transfusion, the client become restlessness, complain of itching on the trunk and arm. Which intervention should the nurse implement first? So try to find the key point in the question. So what the question is asking about. So let's go to the option. Assess the client vital sign, notify to HCP, maintain a patent IV line, and stop the infusion at the hub. What is the first priority for RN? You have 3 seconds to choose your answer. 1, 2, 3. So this question's right answer is 4. Stop the infusion at the hub. Option is anytime the nurse suspect the client is having a reaction of the blood or blood product, the nurse should stop the infusion at the spot closest to the client and not allow any more blood to enter the client. This is the nurse first intervention. Option first, second and third is also important, but the question is asking first intervention, first implementation. What is the first implementation? So stop the infusion at the hub is the first priority. Let's practice on fourth question. Which task is most appropriate for the home health nurse to delegate the UAP? Option first one is changing the client's subclavian dressing. No, it's RN's responsibility. Reinserting the Follis. No, it's LPN responsibility. Demonstrating ambulation with a walker. No, it's RN responsibility. Getting the client up in a chair 3 times a day. Yes, so that come under in UAP. So right one is fourth. Look for the rationale. The UAP can transfer the client from the bed to the chair 3 times a day. So these 1, 2, 3 option are the different, not correct for this. Question number 5, last question. The home health nurse is visiting the client diagnosed with end-stage chronic obstructive pulmonary disease (COPD), while UAP is providing care. Then which action by the UAP warrant, which means negative intervention by the nurse? So this question is based on a negative strategy again. Here are the options. Keeping the bedroom at the warm temperature, first one. Second one is maintaining the client oxygen at 2 liters per minute. Third one is helping the client sit in the orthopedic position, and the fourth one is allowing the client in a reclining position. So this question is based on negative strategy. We need to pick the wrong answer, and that's gonna be our right answer. So let's use a elimination technique here. Option number 4, allowing the client to sleep in a reclining position. This one is good. We don't need to pick this one because the question is asking a negative warrant intervention. intervention, negative strategy. So this one is, we just eliminate this option, helping the client sit in the orthopedic position. Orthopedic position is good for them, for such kind of patient. Just eliminate this one also. Maintaining the client oxygen at 2 liters per minute. This is also a right option for this one, but we need to find a negative answer. So I think the right answer is option 1. Yeah, here you go. You're good. So client with the end stage COPD usually prefer a cool climate with the fan to help ease breathing. With the fan to help ease breathing, which means ease breathing. A client would increase the effort would require to breathe. This action would warrant intervention by the nurse. So right one answer is option first. Option second, third and fourth is good. So this is all about today's video. If you have any doubt, any queries, just click a picture of your queries and send it to me on my email ID, or you can just send it to me on my personal mobile number, and then I'll see you there and I'll try to resolve your queries over there, okay? And I personally requested to all of you guys, please try to share this information at least 10 people. You can just share this information in your college, with your classmate, with your college mate, with your junior, senior, and you can just share this channel, this information in the hospital setting with your nursing staff. एक बंदा इस चैनल में 10 लोगों को एटलीस्ट एड ऑन करवा सकता है. आई एम डूइंग अ प्राइसलेस एफर्ट फॉर यू गाइज, और आप इतना तो मेरे लिए कर ही सकते हैं. I will see you soon in my upcoming video, and I'm going to start a new test series regarding NCLEX RN examination के किस टाइप के क्वेश्चन एंड आंसर आते हैं एग्जाम में, किन किन चीज़ों का आप लोगों को ध्यान रखना चाहिए एग्जाम देने से पहले. तो हम टेस्ट सीरीज शुरू करने जा रहे हैं इस चैनल में. सो प्लीज ट्राई टू शेयर this information again in your college, entire college. Thank you so much. Keep watching, stay on this channel. Thank you so much. Bye bye, take care, love you all.